This video is going to show both nurses and patient caregivers how to care for a patient's driveline site using our new Silver Driveline Management System kits. These kits will replace the daily, every 3-day, and weekly kits that we currently have stocked in the hospital. This kit will be used to change the patient's driveline dressing at the frequency in the provider order while in the hospital, or at the patient's desired frequency at home. First, open the plastic wrapping and break the seal to open the kit. Then use hand sanitizer or soap and water to wash your hands. Break the seal on the top section, the removal section, of the kit. Take out the package of supplies, which includes masks, hand sanitizer, and an adhesive remover wipe. Place one mask on yourself and one on the patient. Just a note, the removal section of the kit may include alcohol swab sticks. You don't need to use them. Then use the included hand sanitizer to wash your hands. Wait for the hand sanitizer to dry, and then place gloves on your hands. Using the adhesive remover wipe included in the kit, remove the patient's old anchor and driveline dressing. Throw the old dressing away. Next, use the adhesive remover wipe to remove the patient's old anchor. Throw away the old adhesive remover wipe and driveline anchor, and remove your dirty gloves. Next, break the seal on the application section of the kit. Place the set of gloves to the side. Then, using the sides of the kit, open the drape to reveal the inside of the kit. Off to the side and away from the kit, use the hand sanitizer included to wash your hands. Once the hand sanitizer has dried, put on the new pair of gloves. Start with step 1 on the left side of the kit. Remove the ChloraPrep stick from the kit and pinch the sides to activate the chlorhexidine. Scrub the driveline site using a hashtag motion, back and forth, for 30 seconds. Let the chlorhexidine dry for 30 seconds, and then repeat the process with a second swab, scrubbing for 30 seconds and then letting it dry for 30 seconds. After the chlorhexidine is completely dry, move to step 2. Use the skin prep wipe to prep the skin around the driveline site. This will help the dressing to stay put on the patient's skin. Apply the skin prep pad around the skin where the dressing will be applied. Be sure not to place the skin prep right on the driveline site. Allow the skin prep to dry completely. Then move to step 3, the saline wipe and the silver patch. The silver patch has antimicrobial properties that will keep the driveline clean, but it needs to be activated with saline. Open the silver patch packaging and then open the saline wipe. Gently tap the silver patch with the saline wipe to moisten it. Be careful not to soak the patch. Then place the silver patch around the driveline, with the silver side touching the patient's skin. Next, move to step 4, the dressing. Cover the driveline site using the transparent dressing, making sure that you can see the site through the clear window. If there is a lot of drainage, you can place a piece of gauze on top before placing the transparent dressing. Make sure that the driveline comes through the notch on the bottom. Apply the second closure piece under the driveline and over the dressing. If the patient is in the hospital, you should initial, date, and time the dressing. Finally, place the driveline anchor on the patient's skin. Try to position this away from the waistband, a few inches down the driveline. This is to make sure that the driveline doesn't get pulled from the patient's skin. Pull the tabs over the driveline to secure the driveline in the anchor. If you have been approved to shower by your provider, there is an optional step 6, the shower guard, to keep the site dry. This completes the driveline dressing change. If you're a nurse, be sure to document that you changed the dressing.